أعزائي الحضور، السلام عليكم ورحمة الله وبركاته. أهلا بكم في الجزء الثاني من هذا المؤتمر. ومن منطلق تبادل الخبرات يشرفنا استضافة الدكتور هاني القاضي، استشاري في جراحة الحوادث، وهو ضيفنا من عمان لتقديم محاضرته بعنوان Medical Students the Endangered Species. فيتفضل.
Thank you very much, and I just want to thank the Kuwaiti Medical Student Association for this honor to invite me to Kuwait. I've been also honored to meet your dean, who is a very cool guy. Being a surgeon, it's not surprising. The lecture today, it is not about preventing disease, but more of preventing abuse. If you consider abuse a disease, then it's preventing a disease. The reason why I chose this topic, or this title, the endangered species, is because during our medical training, there were a lot of names given to medical students. I remember in Egypt, I spent 3 months as an elective there, and they used to call them white-coated organisms. And in Canada, they would call them a different name, and so I chose an endangered species because what we do to them, maybe we're trying to help them mostly. However, sometimes our attempts can actually endanger not their success and not their graduation, because everybody graduates and everybody becomes a doctor, but endangers them from being a three-dimensional doctor. And this is what I'm going to talk about in my presentation. So to start with, when you graduate from high school, you score a very high grade and you're the top of your batch, you're full of ambition, pride, you're dreaming of success, and you have high hopes, and you dream that you're going to be this successful person. You join the medical school with the other bright people, and you dream of being this amazing, bright doctor. This doctor is hopefully going to save the world. However, reality hits hard. And the reason why reality hits hard is because we find that the medical student, at the beginning of his career, he has needs. And us as faculty, we should recognize that our medical students, once they transform from a school student to a medical student, it's a totally different life. They become isolated. They become caged between the books and the knowledge and the studying, because we give them large amount of information, that they get isolated from the outside world. Now, do we ask our students about what social problems do they have? Do they travel for a long time to come to the college? Do they have financial issues that they have to deal with? Are they married? Do they have problems at home that is hampering their studies and their concentration? And then the academic needs. As you progress, some of us do very well, and some of the medical students do bad. Now the question is, do we sit with those who do very well and try to push them even more and get more out of them? Because obviously when you do well, that means you have reached to that level of comfort that you have the time and you have the energy to bring out the best of you. When you don't do well, it is not enough to tell you your GPA does not allow you to go forward. It is not enough to tell you that medical school is not the thing for you. And I think that the academic needs for our medical students need to be addressed every single student at a time, not collectively. Not by putting a GPA of, for example, 2. If you get the 2, you pass. If you don't get the 2, you stay behind, or whatever. I think we should address both, those who do well and those who don't. Now the other needs, like for example, we have, I know in your medical school you have people from outside Kuwait, right? Yeah? You have people from Syria? Syrian medical students? Did we ask them as faculty, what's happening back home? How's your family? How is this affecting you? We in Oman, we have students from Bahrain, and the last issue that was in Bahrain, we failed to sit with the Bahraini students. I'm talking about the administration. We failed to sit with the Bahraini students and ask them. I, on a personal basis, was asking them, and I know that they were going through a lot. However, as a college, the college didn't even bother asking about them. So I think us as college, we should address these issues. We should look at the human side of our medical students, not just the academic side. Now, when you progress, they assign an academic advisor. Do you guys have this academic advisor? Yes. Do you know your academic advisor?
Yes.
No? Have you talked to the academic advisor? Did they actually advise you?
No.
No. So that's another thing. And you know what? I'm not surprised because it's the same everywhere you go. And it's a problem. Why is it the same? Why are we not standing up? Because an academic advisor is such an important person in the medical student's life. The academic advisor can give you advice on every single step that you go. So in my opinion, instead of us randomly assigning advisors to the students, I think the students themselves should choose their advisors. Because if I'm a medical student, I'm maybe more comfortable with Dr. Adil to be my advisor, with Dr. Dr. Mervet to be my advisor. I just feel comfortable going to that specific doctor to tell him my problem. And the other side of it is this doctor qualified to be an advisor or not? Not every excellent physician or an excellent surgeon is by default an excellent advisor or an excellent academician or an excellent teacher or an excellent speaker. So I think, again, us as faculty, we should look into this academic advising and revise it again and look and evaluate the advisors and whether or not have they been doing their job properly or not. And you go on from there, and we cram knowledge and knowledge and knowledge and knowledge down the throat of our medical students. Now, how much of this knowledge that we give our medical students is important for them to become good doctors in the future? Now, this we have to, assess periodically. We have to reassess our curriculum over and over again. And the curriculum, in my opinion, is best assessed by asking the students themselves who have gone through it and those who are going through it as we speak. So we get feedback from them and act on it. And then we have to look at the graduates of the medical school. Did they really use the knowledge that we're giving them, or we're just shoving knowledge down their throat, thinking that this is the best for them, this is what a doctor should know, without really thinking, is it really true, or this is just what we think of? Then you got those who are, excelling in the other part of their life, not necessarily medicine, but they have extracurricular activities. Is any of us here sitting in this room a hidden musician, a hidden poet, a hidden actor or actress, a football player. Now, a lot of medical schools think that extracurricular activity is such a waste of time. And I think that's a big mistake because, you know, if you go to the West, and I don't glorify the West, but this is one thing that that I admire in them, is that they respect the extracurricular activity because it does contribute to the personality of our doctors. We can't just graduate doctors who have good knowledge. We need doctors with personality. And I think if you have a good doctor with good extracurricular interest, that will give this extra dimension to our graduates and make them excel even more. So in my opinion, I think extracurricular activities should be contributing to your GPA or to your progress. I don't know if you agree with me or not. So after this, the preclinical year, you go into the clinical year and your ego inflates and you become this cool doctor who walks around the hospital with a stethoscope. So when you enter the clinical years, before we venture into the clinical years, I'd like to discuss two definitions. One of them is medical student abuse. So the definition, it's a common practice in which medical students are psychologically abused by superiors who badger, belittle, and have them perform degrading tasks. There's another term which is called pimping. Now, pimping, it's interrogating a medical student mercilessly regarding the knowledge of a subject. For example, in the ward rounds, I ask a medical student a question, the medical student does not know, and I keep harping with that question. You know, keep squeezing that medical student in front of the colleagues, in front of the medical patients. That is what is called pimping. So for those who like literature and research, the literature and journals are full of studies about the effect of medical schools on students. This is one study published in JAMA in 1990 about the incidence and severity and significance of medical student abuse. So of the students that they have surveyed, 80% of them reported abuse. 50% of them said that the abuse affected them for a long time. And 16% of them said that the abuse during the medical school affected them for life. Now that's another study. Medical students' mistreatment results in symptoms of post-traumatic stress disorder. 71% of the students who reported abuse were studied for symptoms of post-traumatic stress disorder. And sure enough, 73% of those showed symptoms of post-traumatic stress disorder. Now, in the BNJ, experiences of belittlement and harassment amongst medical students, if you notice that this on entry to the wards, that's in the junior years, those who reported abuse, actually the majority of the abuse was by fellow students. So senior students abusing junior students. So they're tyrants in the making, you know. And then when they become senior means in the final years of their medical school, they found that the professors and the other senior residents take over the process of abuse. But it's funny to see this result. So above 2,000 students were studied, 42% of them reported harassment, and 84% complained of belittlement. And this is the last study that I'll show. Abused children and abused medical students showed exact same effects in this study, published in JAMA in 1990. They showed gradual transformation from eagerness and enthusiasm to depression and fear. Now, let's stop at this for a little bit. I'm not talking about abuse, physical abuse. It happens sometimes when we have to. No, I'm talking about emotional abuse. I'm talking about that emotional abuse could be something subtle that we don't notice. When a medical student comes to me complaining and I just shoo them aside. When the medical student comes and tells me, doctor, I think, or we think, that the step that you have done is wrong. Can we sit back and change it? No, it's good. This is good for you. We know it's good for you. You know, this is belittlement. Let alone what happens on the ward on day-to-day basis. So, we go back to our student who entered the clinical years. Do you guys have coordinators for your rotations? Yes. So, the coordinators must be chosen very, very carefully, because the coordinators are the ones who actually monitor the teachers or the doctors' behavior and the students' behavior at the same time. So the coordinators, it should not be just an administrative job. It should be something that, you should be someone that can actually make a difference, can actually go to a doctor and tell him, excuse me, I don't think you're conducting your teaching in a proper way, and I think this has to change. So the coordinator is very, very important for each rotations. And then, when you walk with the team in rounds, inclusion. Do we include our medical students during ward rounds? That's very, very important. Very important. Do we ask them, what do you think? What do you think? What do you think? How should we treat this patient? Why do you think this patient developed a complication? Do you think what we've done is right or not? And you know, more than often, medical students actually came to me and reported stuff that my team did not know about. And a lot of times, because the medical students, they take more detailed history. If I give them the power to speak, and the power to give me feedback, and the power to say their opinion, more often than not, I actually benefit from this. And then on calls. So on calls, the medical students should actually be very active in the on calls. They should not be just a number, just, you know, they're there, okay, they're not there, it's okay. I think, and again, I go back to the West during the residency in Canada, and I'm sure, you know, I speak of it because I was there. I see the medical students, and they're very bright, and all medical students are bright, and your brain is as good as you push it. And I think our medical students can be as good as we push them. So if we ignore them, they will not perform. I see medical students there who just came out of the preclinical. They have no clinical experience. And on the first day, you hand them a pager and you tell them you're on call. You have to answer the calls first and then speak to the resident. And they do very well. They struggle a little bit, but they do very well. They pick up very quickly. So I think on call is a very, very important step. Professionalism. How often have a consultant or a doctor yelled at you in front of a patient? Maybe not here. I get students coming to me and saying that the consultant was rude to us in front of the patient, yelled at us in front of the patient, and that is bad. The other thing is about colleagues. You find doctors speaking about fellow colleagues in a derogatory way, and that is bad in front of the students. And patients, sometimes you see doctors discriminating against patients. Sometimes because of nationality, sometimes because of socioeconomic status. and I find that as well in my hospital, where doctors take more care if you're VIP or if you're rich than if you're this poor woman or poor man who's coming with no relatives and so on and so forth. And when I find this neglect to the patient, I ask him, if this patient was a VIP, would you have forgotten to write the insulin sliding scale to this patient? Would you have forgotten to write the hypertensive medication for this patient? Would you have not come to correct her hyperglycemia at night? And that's when they get stunned. So we do have this active unprofessionalism in front of the medical students, and that's bad. Whenever we have the medical students, we have to make sure that we act at our best level of professionalism, because they copy us. No matter what we do, they will copy us. And it's very nice for us to set an example for them of how to treat medical students, how to treat fellow colleagues, and how to treat patients. And especially the poor patients, the unprivileged patients. The feedback forms. I know you have feedback forms, and we do have feedback forms as well in our college. Now, this is a study that was done in our college, asking the students, what do you think about the feedback? 80% of them reported that they're not really interested in the feedback. And 83%, they said, we don't get the feedback regularly. We don't feel it regularly. And 55% of them thought that it's not useful. So it's important to have feedback. But with the feedback, it's important to have empowerment. We cannot hand out feedback forms and we get the feedback forms back saying that this rotation is bad, or that exam was bad, or this teacher is bad, and repeatedly, and then we don't do anything about it. We might as well not do it. So empowerment of the feedback is very important. Empowerment of the medical students is important, and I'm glad to see the Kuwaiti medical students that they have an association and they're gelled together under one leadership, and that's excellent. I congratulate you for that. In the empowerment, you find doctors saying us and them. We were them before we become us. We were medical students. We were medical students and we were complaining about bad professors. We were medical students and we were complaining that they were not listening to us. And all of a sudden, when we become them, we complain that the medical students are complaining against us. Funny. We should respect the medical students' opinion. I mean, we don't have to change everything just because somebody came and complained. However, we should respect their opinion. We should show them that we actually care about their feedback. We actually care about what they think. Because what we have in our medical school are the best and the brightest of the community, of the society. If we do not respect those minds, who are we going to respect? The power of change is also something that we have to make the students feel that they do. They do have the power to change. Career development. It's something that is lacking mainly in, I'm sure, definitely in our college. I keep insisting that we have this. We have to sit with the medical student at early years, at year 3, year 2, and counsel them about their career, about the USMLE. Is it important to do the USMLE? How to apply for the USMLE? What can we do to help you do the USMLE? What is the use of doing the USMLE? Should you do it? Should you not do it? The Canadian exam, for example, or the MRCS, or the TOEFL, or the IELTS, those exams, our medical students don't know about them. And all of a sudden, when they graduate and they become interns, they found, oh, you have to do the USMLE. You didn't do the USMLE? You didn't do step 1 yet? Hello? Okay? And that happened to me. I found out after I graduated that I have to do the USMLE. Nobody talked about it before. And it's very hard to do it then. CV writing, it's something that our students should know how to do. They should be coached on how to write their CVs. Because as soon again as they graduate, they need to write their CV to apply for a job or to apply for an interview, for a training post. So CV writing is something very important. Then the career, the specialty. What specialty do you want to do? Can I sit with you and counsel you? We can have a career day, but early on, not after you graduate. A career day with all the doctors present, and then you can go and speak to them. So that you decide at an early stage, or you don't have to decide 100%, but maybe you can narrow your decision to 1 or 2 specialties. Interviewing skills. Whenever you apply for residency, whether here or abroad, you're going to go through an interview. And I do interviews for surgery back in Oman, and I find problems with the residents coming, or with the candidates coming in the interview, just because they did not know how to go through an interview. And I think an interview skill should be something that we should teach to our medical students. I think this is almost my last slide. Technology. Now we know technology is booming, and I'm sure half of the room here is tweeting now, or WhatsApping your friends. We still have books in our medical school, which is something really nice. I honestly, I'm not against books. However, I always tell my students to not read books alone. The book, if you have a book that has been printed in 2010 or 2009, the starting of writing this book has been 5 years before, so it's 2005. So you're reading 2005 knowledge. And you just heard Dr. Mervat that every month there's something happening with breast cancer, for example. Take anything, thoracic surgery, take anything, vascular surgery, diabetes, asthma. Things are changing so fast. If you rely on books, you're going to become an old-fashioned medical student and not updated and we also do not stimulate you to go and research, because you have that book that you believe that this is the Bible of surgery or this is the Bible of medicine. I'm going to hang to it. And you find doctors 20 years after they graduate holding to their book from medical school, because that's the book. So I think we should encourage the students to go to the internet. And I think, in my opinion, that we should drop all books and give every student an iPad. And I told you Dr. Adil is going to hate me after this. If we calculate iPad or Samsung, whatever, I'm not advertising for Apple. I'm saying that if we calculate the money we're paying for books, it would be much cheaper to buy an iPad for every student, and the student can download the applications through iTunes, and all these books that we're giving are on iTunes. In addition to that, you can get journals. There's BMJ Student. There's so many stuff that are really important and good for the students. Telemedicine is very nice. Telemedicine is something that we should have in our medical schools. I should be able to give a lecture in Oman and broadcast it in Kuwait. Dr. Adil can give a lecture or do a surgery in Kuwait, and I broadcast it to my students in Oman. It's very important, and it's everywhere. And it's about time that we introduce telemedicine to our medical schools. Podcasts. If you guys don't know what podcasts are, it's on iTunes, and you can go. Every famous university in the West, they have their own podcast, where you can go and look at get lectures for free. So lectures now are not in lecture theaters. The lectures are on the web. You go watch the lecture, and then you come to the hospital. So you don't spend more time in listening to a doctor speaking or looking at a PowerPoint presentation that is full of knowledge and full of words. You listen to the presentation at home, you do your reading, and then there's time for you to do your clinical work when you come to the hospital. And I think that's where we should be heading. So finally, this is what we should aim for. A three-dimensional medical student. A student who combines knowledge, and not Einstein knowledge, but knowledge, enough to make him a safe doctor. I should not teach my medical students in surgery to become surgeons. I want them to become safe doctors, not surgeons. And similarly in other specialties. The attitude, the respect, when they see us respect the patients, they will respect the patients. When they see us respecting each other, they will respect each other and they will respect us. So the attitude of the medical student is very, very important. We should listen to them and we should encourage them. When they see the support that we are giving to them, it is infectious. I always say good energy is infectious. If we give them good vibes, they will give that good vibe to whoever follows them, and so on. And finally, personality. The personality of the student is, again, stimulated not only by reading books, not only by being the Harrison of the medical school, but by other dimensions. Those who have organized this conference, they should be rewarded. Because this is an organizational skill. An organizational skill is very important. It is a pride for me to graduate a medical student from my college who can stage such an event. And as Dr. Hani said, on their own. That's the first word that he said to the Minister of Health. The medical students. That the medical students did this thing on their own. So those students should be rewarded, and so on and so forth. So the personality of the medical student is very, very important. Those who are shy, those who don't talk, they sit at the back and they just can't speak up. We need to address them. We need to help them bring the best out of them. Because not necessarily those who talk louder are the best. We have the best minds can also be quiet and shy. So those ones we have to address them because that part of their personality needs to be stimulated. So in summary, medical students are a great asset, not only to the college, but to the society and to the country. We should have careful considerations for their needs. Whatever needs that they have, we should address them and we should take care of them. And literally take care of them. We should empower them because, again, great minds cannot be set free if they're not empowered. If they're oppressed, then you're ruining that great mind that you have. We should have zero tolerance for abuse, in whatever form it comes. There should not be any tolerance for abuse. And finally, we should recognize the full potential of every medical student in our college as much as possible. Thank you very much.
نشكر الدكتور هاني القاضي على إلقاء هذه المحاضرة ضيفنا من عمان.